This is Dr. Lucy Rathier, and today I'm going to tell you about our Satisfied and Slimmer program, which is a plant-based lifestyle plan, including behavioral strategies for long-term weight management and improved health. This program will be co-led by Kristen Curtis, who is a registered dietitian certified by the Academy of Nutrition and Dietetics, and Dr. Lucy Rathier, who is a licensed psychologist. Both of us have had extensive experience working with patients in weight management. So let's first start by talking about the factors in obesity or overweight. There's multiple factors involved. Oftentimes we see our families that of origin that are overweight, and we think it's strictly genetic. Well, obesity emerged in the last 40 years. Genes can't change that quickly. Genes do account for about 30% of the variability in weight, and that's actually good news, because if genes accounted for 100% of the variability, we couldn't do anything to change the situation. More likely what happens is eating runs in families. Our eating habits, the way foods are prepared, portion sizes are often dictated by family members as we're growing up, and that's how we learn to eat and may be at more risk for being overweight. Coupled with that is that Americans have become more sedentary. Lots of things can be done remotely. We don't even have to get up to change the turn off the lights anymore. We can do that from our cell phone. So that has also contributed to being overweight, as well as lots of food accessibility, the toxic food environment, which is having lots of processed foods, fast foods, convenience foods readily available to us, and the presence of food swamps. And here you have a picture of a food swamp, because there's lots of fast food establishments in close proximity to each other. In the villages in particular, we have a lot of social norms regarding food. Pretty much every social event has food that is a part of it, and usually foods that aren't the healthiest choices. Portion sizes at restaurants have increased, and we're eating them. And foods are rewarding to us. They activate the center of our brain called the reward or pleasure center, which we're going to talk about in a minute. But the main culprit in being overweight is eating too much food with a low volume, meaning it doesn't fill us up, but has high calories. So let's go back and talk about that hyperactive reward system in our brain. So we are actually hooked by the food industry giants. So we used to eat lots of foods that were healthy for us: fresh fruits and vegetables, whole grains. And then that shifted to industrialized products. And notice I don't call it food. They are really products that may not have a lot of nutritional value to them. An interesting fact is that Kraft was acquired by Philip Morris, the tobacco company, and they hired brain experts to determine how much sugar, salt, and fat were needed to send the message to the brain to activate the pleasure or reward center in your brain. So what happens once that center is activated? You want more and more of those unhealthy treat foods, and you become hooked. Just like with cigarettes, those food manufacturers want to hook us early. And so what they've done is determined what they call the bliss point, meaning what's the combination of fat, sugar, and or salt in just the right ratios so that it activates that reward center and makes it hard to stop eating them. So, for example, chips have a an optimal amount of salt and fat. Donuts or candy bars have an optimal amount of sugar and fat. And those manufacturers of those products make sure that at least 2 of the 3 are in the products that they sell. So what exactly happens? So you might have a craving for something like pizza. And so you eat it, and the stomach breaks down the pizza in what's called chyme, which is a pulpy acidic fluid that passes from your stomach into your small intestine. And from there, the signal goes to the brain. And there's a surge in dopamine. And dopamine is the chemical that makes you feel pleasure. So that pleasure center is activated. And what happens? You crave more of it. And the cycle perpetuates. Interestingly enough, though, fat, sugar, and salt are not combined in nature. If you look at all the foods that Mother Nature has brought us, none of these have a combination of the 3. You have sweetness in the sugar in fruits, but you don't get the fat and salt. So why would we want to do a plant-based diet for weight management? Well, one thing is to look at the research findings from the Loma Linda Seventh-day Adventist Health Study. So Loma Linda is in California, and in this community, there is a high population of people from the Seventh-day Adventist faith. In this faith group, they do lots of healthy practices, meaning that they eat very little animal products. They eat more fruits and vegetables. They don't drink alcohol. They don't drink a lot of caffeine, and they exercise regularly. And in fact, Loma Linda is one of the blue zones. So there are 5 blue zones on the planet that were identified by Dan Buettner of National Geographic. And this is where people live to be 100 years old in good health, living independently. So they looked at, well, what are these people doing? What are they eating? What is their lifestyle? So Loma Linda was one of the areas that is considered a blue zone. And so if you look, first over here, you've got this chart of, the vegetarians going all the way to the non-vegetarian, one that follows the traditional American diet. So you can see that the vegetarians, the true vegans, total vegetarians, are not eating any animal products, and dairy and eggs count as animal products. Then you go to the lacto-ovo that may not eat the meats but eats the dairy. Then you go to the pesco-vegetarian that has fish but not meats and dairy. Semi-vegetarian that eats a little meat, a little fish and chicken, and some dairy, all the way again to the traditional American diet. So these colors correspond with this chart, and you can see the weight difference. So in the individuals that are completely vegetarian or vegan, they have the lowest weight just by nature, just by following this food plan. So women in this Loma Linda study, on average, weighed about 140 pounds, and men about 160 pounds. You can see the distinct difference. For women, those women that followed the traditional American diet that were carnivores weighed on average 40 pounds more. And those men, on average, again, about 30 to 40 pounds more. So you can see as well that those that had less of the meat products also had lower weights than those that ate red meat, poultry, fish, and dairy products. So there seems to be something to eating more plant-based diet. One of the reasons is that with a plant-based diet, you feel more full because you're eating foods that are high in fiber and water, and that activates the stretch receptors in your stomach. And so when they're triggered by food, they tell your brain to stop eating. So you can see these high fiber, high water, whole plant foods fill up your stomach on 400 calories. Whereas if you had 400 calories of beef or 400 calories of oil, you can see that it does not fill up your stomach because there's no fiber or water in these foods. Just looking at the difference in the same amount of calories, in each of these pictures, there are foods that add up to 1,575 calories. In the high energy density foods, that means foods by which a pound of them have more calories than, let's say, a pound of lower calorie density foods would have less calories. You can see the chips, the Danish, the cheeseburger, the fries, the pasta. Um, there's not as much, the soda, there's not as much food. If you're looking at the plant-based diet, look at all the food you get. Look at the volume of food that you get for the same amount of calories. Essentially, what's happening is you've got lower energy density. You've got these plant-based foods that only have 2 calories a gram versus refined carbohydrates, which can have 4 calories a gram. That more food volume, bulk. It takes longer to chew them, so that slows the rate of eating because the fiber in the fruits and vegetables and whole grains. That means your stomach emptying is slower. It reduces your hunger. It helps to attenuate your blood sugar levels, promotes insulin sensitivity so that the insulin works more sufficiently. You have better health in your digestive system. And essentially that results in lower risk of weight gain and obesity, reduced risk of fat around your abdominal area, which is important because that's where your vital organs are, and it helps promote weight loss. So when we're talking about what exactly do we want to do in this plant-based diet program, well, we're talking about a whole food plant-based diet. So trying to eat more foods that are whole, unrefined, or minimally refined. So that means fruits, vegetables, tubers, which are like potatoes, sweet potatoes, those um, foods that grow underground, whole grains, rice, um, whole wheat, uh, barley, and legumes, beans, lentils, peanuts. It excludes or minimizes meat. So in this program, we're not saying that you can never eat meat or poultry or fish or dairy again, but we're trying to reduce it in favor of eating more plants and whole grains. And we are definitely encouraging you to eat less refined foods, less foods with white sugar, with high fructose corn syrup in it, with white flour. So are you only going to be eating lettuce? Of course not, because it would be impractical. We need to eat pounds of cooked kale to get 2,000 calories of food. And when people eat mostly salad to try to lose weight, it's hard to sustain. You get hungry, you feel deprived. That's why in this program, there will be starch-based foods and fruit. So again, you're eating more of those potatoes, sweet potatoes, the starchy vegetables like corn and peas, whole grains, brown rice, quinoa, millet, buckwheat, barley, and again, the legumes, the beans, the lentils. You still will eat the leafy greens and vegetables because that's a great source of nutrients, fiber, filling for you, and those are complementary as well. So what are we talking about here? Again, in a completely vegan diet, if you look at this comparison, there's the elimination of the animal products completely. What we're talking about, see where it says here in the yellow, avoid, meaning we're reducing it. You don't have to entirely eliminate it, but you're going to eat more of these foods and less of these foods. And if you're going completely whole food plant-based, which is an option, right? You don't want to have as many of the processed foods, right? The white flour, the white sugar foods. And in a whole foods plant-based diet, they favor the whole food over the processed food. So in oils, for example, instead of using olive oil, they're going to say eat the olive. Instead of using avocado oil, you're going to eat the avocado because you're getting the fiber and other nutrients from that. And you could, for example, saute vegetables in a vegetable broth, which actually comes out really nicely as well. So again, the main thing that we're looking at here is the calorie density. So when you eat foods with low calorie density, you're still going to have meals that have about 500 calories per pound in the types of food you eat. You're going to get the correct number of calories that you need to lose weight or maintain a healthy weight. Because if you eat foods with a high calorie density, the pizzas, the brownies, the ice cream, um, less space is going to be taken up, and you're going to have to eat more of it to feel full, and that's what gets us in trouble. So essentially, we're eating more of these foods, right? Because you can see the calorie density per pound is 600 or less, it's 100 calories for vegetables, and you're going to eat less of these foods. And that includes some healthy foods. Avocados are healthy for you. You just can't, eat a whole avocado every day. And again, nuts, seeds, nut butters like peanut butter, they're healthy for you. But again, look at the 2,800 calories a day. You have to eat them sparingly. So you're going to eat to be satisfied. You want to get to 80% fullness of your stomach. And sometimes when we excessively control portions, it can lead to insufficient calorie intake. So here we're increasing the volume of food, but still consuming fewer calories overall. And if you are still hungry, you can eat additional low calorie density food. So you can have another piece of fruit, for example. What about if I have certain medical conditions? How's that going to be affected on a plant-based diet? Well, there's nothing really that unique about meat, dairy, or eggs that you can't get the same components from plants and their supplements. And typically, you can work around the food restrictions that need to be observed for your specific medical conditions. Some medical conditions may make it harder to be plant-based, so we don't want anything that restrictive that it fails to meet your nutritional needs. And variety matters. And that goes for anyone, whether you have a medical condition or not. You want to have a lot of variety in your foods so that you get all the proper nutrients necessary. Always, always, always consult with your healthcare providers to let them know that you're going to try this program and transition to a plant-based diet. Discuss with them any medications that you're taking to manage your medical condition. You might find your blood pressure gets lower, your cholesterol gets lower, your blood sugar gets more normal, and you might find actually that you don't need as many of those medications, if at all. But the healthcare provider is going to be the one that will need to adjust the medication or dosage as your health improves. And of course, Kristen is a registered dietitian. She's very knowledgeable in the dietary needs of people with varying medical conditions. So she will be there to answer all your questions as well as present the information. A lot of times people have concerns about eating a plant-based diet. One of the concerns is I'm not going to get enough protein. We have been socialized to think, we need lots and lots of meat to get adequate protein. Well, according to the Dietary Reference Intake Report for macronutrients, we need 0.36 grams per pound a day. So typically that's 56 grams a day for the average sedentary man and 46 grams per day for the average sedentary woman. So proteins are an energy source made up of different amino acids, and about 10% to 35% should come from protein. But again, besides the traditional sources of protein, soy and other plants like beans, quinoa, spinach all have protein. It's kind of a misconception that certain foods only have certain nutrients in them. To a certain degree, many of our foods, including some vegetables, have protein in them as well. And the biggest concern is that the protein from animals have high saturated fat. The fat is marbled through them, and that is what contributes to heart disease and being overweight. So if you look here at this chart that illustrates how much protein is in certain foods, okay, so all of these, we're talking about 3.5 ounce servings. So in 3.5 ounces of chicken, you have 31 grams of protein. In the same amount of tuna, 29 grams, beef, 28 grams. Look at these non-meat vegetarian sources. Same amount, 26 grams in lentils, 21 grams in black beans, quinoa, 14 grams. And even in some of the vegetables, you're getting some protein. So what does this mean? Well, if you're eating a well-balanced meal, so let's say you were having black beans and quinoa with mushrooms and peppers and a little avocado, right? You combine all that, you can match the protein that you would get from an animal source. Complete proteins have all the amino acids. So oftentimes, in meats, you typically have a complete protein. However, you can combine foods that are vegetables or grains or nuts to get a complete protein, or some of them are complete proteins in and of themselves. So to combine them, rice and beans, hummus and peanut butter and whole grain bread, oatmeal and pumpkin seeds or peanut butters, these combinations all give you complete proteins. These foods, quinoa, soy, Ezekiel bread, which is a sprout bread, which you can find in the frozen foods section of your grocery store, chia seeds, buckwheat, nutritional wheat, those foods don't need to be combined because they are complete proteins with all the amino acids. And it's better to eat these whole foods than these processed vegan mock foods like the Impossible Burger. The frozen entrees can have a lot of sodium in them, things like that. So it's better to eat the whole foods than those. And you can see if we talk about that blue zone diet where people live to be 100, or the Mediterranean diet, where are they getting their protein from? Mostly from beans. In the blue zones, they have at least a half a cup, if not more, a day. Mediterranean diet, they have a half a cup 3 times a week minimally. They do eat fish, they do eat meat and poultry, but look at how much, right? The blue zones, 2 ounces 5 times a month. Mediterranean, 6 ounces a week. So they are having them just in reduced amounts because they favor the plant-based foods. And these are diets that many health institutions recommend. But won't I be gaining weight by eating these carbs? Well, when we think of a carbohydrate dominant dish, it's not really the dominant in carbohydrates. It's really a high fat dish. The potato itself is mostly carbs with some protein and very little fat. When we eat them in French fries, it's mostly the fat that increases, and it reduces the protein and reduces the healthy carbohydrate. If we're having whole grain pasta, again, relatively low fat, there's some protein, mostly carbohydrate, but when we put pesto on it, look at the percentage of fat. So we're really eating high fat dishes, not high carb dishes. So what does it really make us fat? Fat. It's effortlessly stored in our body. It has more calories per bite. As we saw before, it takes up less space in our stomach. We want to eat the healthy fats, but in moderation because they are very calorie dense. They're healthy for us. We just have to be moderate in our intake of them. Another concern, it's too expensive to eat all this produce and or organic food. Well, let's take a look at some typical meals. Here is a McDonald's meal for 4. So we've got the burgers, the fries, the chicken nuggets, the fish sandwich, the fries, Coca-Colas. For 4 people, it costs almost $28. And of course, we look at the nutrition, 900 calories per person, 37 grams of fat. Now, let's look at if we made a meal with meat in it at home. So we've got chicken and milk and bread and potatoes and salad greens and some lemon and some oil. Okay, so it's about half the price, $38.78. We still are high in calories, 934 calories, still high in fat, 39 grams of fat, and 80 grams of carbohydrates. And here the carbohydrates is 123 grams. Now let's look at if we had rice and beans, an onion, and some milk. Well, it's even less. It's about a quarter of the price of shopping at McDonald's. And moreover, less calories, 571, less fat, 15 grams, equivalent amount of carbs, and still getting 26 grams of protein. Also, if you think organic foods are high, and you don't necessarily have to eat organic, although there are some benefits to it, but let's look. We're worried about the price of organics. If you buy Kit Kat candy bars and you priced out how much it was per pound, it's $9.49. If you went and got some gourmet coffee, it's $20 a gallon. Even if you get some soda, that's $8.89 a gallon. Chips cost $8.45 a pound. Look at what you can get for fruits and vegetables. At the Villages Grown, ahead of their organically grown lettuce is $3. For 75 cents a pound, not $8.45 a pound, but 75 cents a pound, you could get some potatoes at the Villages Grown. You can, on sale at Publix, you can usually get 2 containers of organic tomatoes for $4, 3 bags of broccoli or some other frozen food for $6, Gala apples, a bag for $5. At Walmart, you can get organic bananas for $1.63 a bunch, or $1.46 for a pound bag of organic carrots, or a can of beans, organic, cost 94 cents. So would you rather be paying $8.45 for chips per pound or 75 cents per bag of potatoes? In this program, we're also going to cover some behavioral topics like managing urges, how to eat more mindfully, how to be more aware of our hunger, timing the meals. There's a lot of information out there about intermittent fasting and things like that. And we're going to talk about the research on how to time meals, how to make meal prep easier, and how to dine out, how to get good social support and refuse the people that might be pushing unhealthy foods on us, how to be dealing with the toxic food environment and stimulus control, which is those triggers in the environment that might tempt us to eat foods that aren't healthy, how to prevent a relapse, dealing with setbacks positively, and how to increase physical activity. So essentially what's going to happen is that you're resetting your physiology. Eating less and exercise may not be more consistent with a sustainable lifestyle. Counting calories alone may not have the same effect on your leptin and ghrelin, which are those chemicals that help you to determine whether you're full or hungry. It's about changing the quality of the food, not the quantity. So we're not trying to restrict you. We're trying to reset your physiology so your body is eating foods that are healthier and knows what normal portions are. If you're interested in learning more about a plant-based diet, on YouTube for free, you can watch the Forks Over Knives movie. If you have Netflix, Game Changers is on Netflix. There's also the Zac Efron documentary series, Down to Earth. And in the 4th episode, they go to Sardinia, which is one of the blue zones. So you can learn more about that. Our program is 7 one-hour sessions. In the first 3 sessions, both Kristen and I will be there and Kristen's going to educate you a lot on your plant-based diet. And the remaining 4 sessions will be behavioral. The program costs $70. We do have a special offer. If you register along with a spouse, partner, or friend, your registration is reduced to $55. So if you are interested in this program, please call Kathy at 352-674-1779 or that email address. You can also email her, and we would be delighted to register you. And we hope to see you there. Thank you for your time.